in the nursing profession for veterinarians. One thing that is also unique to Oklahoma is we just passed legislation which allows registered veterinary technicians to go out on the farm, do anesthetic, float teeth, which means you file down the sharp points of the horse in the mouth, and do reproductive exams, artificial insemination and all, without a licensed veterinarian being right there because of their training. So we're one of the first states in the U.S. to actually do this. We're pretty excited about that. So, currently Maribel is feeling no pain. Veterinarians are very concerned and cognitive of if you have surgery, it is controlled trauma, right? So we're taking a sharp scalpel, razor, cutting in and taking tissue. Well, we want to prevent discomfort, so we use a product called Rimadyl, Metacam. I mean, there's a bunch of NSAIDs, non-steroidal anti-inflammatory drugs, but the favorite of most of us tends to be Rimadyl. It has a COX-2 inhibitor to prevent pain, kind of like a Tylenol, as well as an NSAID, which is a non-steroidal anti-inflammatory. So less swelling. All of this has been done ahead of time so that when we get to surgery, she has peak blood levels and we minimize the amount of discomfort. We also have everything available in human medicine, we have in veterinary medicine. If I'm doing an orthopedic case, Demerol, Valium, morphine, you name it, we can do it. Okay, so pain management is really important. And unfortunately, we're not going to get to see the show tonight. I hate when that happens. No. Anyway, so.
I got a question for you.
Yes, ma'am.
What are the fluids that are flowing?
Probably just lactated ringers. We have sodium chloride. We have, usually it's not necessary with dextrose during the surgery. So what you're seeing is all the preparation that went on here. We do a pulse oximeter, and with a pulse ox, it monitors their oxygen saturation level as well as their heart rate. It's everything they do in the human hospitals. Okay, we also can monitor body temperature, blood pressure, cuffs, and all that. On the short-term surgeries, it's really less important, but it is an option that we have with the more critical care. Dr. Setzer and company, Anna and Ashley, are in the process of setting her up. If you notice the little black top, that is a heated table. Sometimes when animals, humans, are under anesthetic, they go cold, especially on a cold table. And preferably doctors, with all these gowns and all that, really like the air conditioning cranked down. So if you've been into any kind of hospital and getting ready for surgery, have you noticed that they come out with these heated towels and blankets now? Well, that's what we're doing for our dogs and cats and our other surgeries. So at this point, in Minnesota veterinary colleges, we're 100% female freshman class. So there's been a real change in the dynamics of veterinary medicine. We've had a little bit of a food animal frustration because most of the people are kind of pulling off the farms. So currently, you can see Dr. Setzer is meticulously getting in, you all can see it, in sterile application. And somebody brought 7.5 gloves for 8.5 hands. But anyway, great. And Maribel has now got a home, so thank you all. So at this point, Maribel is 45 pounds, and she appears to be a Great Pyrenees mix, maybe a Great Pyrenees mix or a Border Collie mix, and she has a home. Animal Aid will be doing this all week. Disposable because, again, labor intensive and sterility is very, very important. So and he can make as large a hole as necessary, and he's got everything. It's always nice to line all your surgical instruments out and kind of get everything situated, as they say. So he's completely gowned, sterile. Everybody's got their footies and their face mask on so they don't breathe on anything. Display and getting everything situated still. Are there any questions so far? This is a dog. It's a Great Pyrenees mix. So if you come on over here a little bit more, you can see. It's kind of hard just to see the pictures. So Dr. Setzer is opening up a little spot. You can see a little hole that he's created. Yes, ma'am.